Okay, so good afternoon, everyone. Today we're going to do our orientation to tell you more about the program, the course, and what the program consists of, as well as the Nclex exam that you all wish to attempt. All right. So Phoenix Occupational Health, where we believe in transformation through education, is the organization that offers Nclex to nurses in Trinidad and in the Caribbean. All right. Sorry, it's supposed to be in Nclex 2024, 2025. So I'll tell you a little bit about myself and the company. We'll start with the company first. So this company was established in 2020, and we initially just offered basic life support and advanced coronary life support for healthcare providers from the American Heart Association based in the US. We also do first aid CPR and AED use in non-healthcare workers, and ECG and arrhythmias interpretation. And most recently, as of 2022, we started Nclex preparation for students who wish to go to the US and sit the exam. A little bit about myself. My name is Miranda Ramjata. I'm a registered nurse, both emergency and ICU, as well as a trained preceptor for nursing. I'm also employed at Southwest as a district health visitor, and I do customer service training for them. So those of you who work Southwest might have been in my class. I am an American Heart Association instructor for BLS and ACLS. And as I said, I was a district health visitor and most recently completed my master's in public health. This is what I look like in case if you all don't know me. I have slightly brown hair now, but basically this is me with makeup on. So Nclex, one of the burning questions that you have is how much this is going to cost me. All right, so we've made it a little bit affordable for you. I've broken down all the fees that you have to put out together here. All right, but mind you, these fees are not to be paid upfront. It is spread over a 6 months period as the need arises. I'll explain it to you now. So most foreign-based countries, they normally ask for IELTS, which is an English-based exam. However, not all the nursing boards require it, right? So we're going to hold on that for now. We have to, well, if the nursing board or CGFNS asks for it, then we will do it. Okay, if it's part of our request for getting with a board only, then you will do it. So we're going to put off that fee of $2,200 as well as the $500 to send it across. The CES evaluation. So your first cost is your tuition cost, which was $4,000. All right, that's your first cost that you have to pay upfront. Within the first 2 months, I would advise you to do your CES evaluation. That is at a cost of $485 US, right? In order to start your process to get into Nclex, you have to pay this $485 to CGFNS for them to do what is called your Credential Evaluation Service, or your CES. This looks at your nursing school, the number of hours, your transcript, as well as your license verification. Once you pay that $485 US, they will give you the 2 forms that you need to take to Nursing Council as well as to your School of Nursing to be completed. You are not to send the transcript nor your license verification. It must be sent directly from the organization. So if you went to Nursing Council, it's about $750, and that's included in the cost of sending it across, right? They use DHL delivery, and they will send it across to CGFNS. Now, the reason I ask you to do this one as soon as you can afford it is because Nursing Council has a delay strategy. They would take up to 4 months, even 6 months if you don't follow up with it in order to send it out. And at times they've sent it out without signatures and stamps. It occurred to me and it occurred to one of my students. I don't know how they can send an official document that you're paying for without an official stamp or signature from Nursing Council. But again, it's all part of the strategy to frustrate you all in migrating. The transcript, if you went to Costa Rica Ministry of Health, is approximately $250 and another $500 to send it across, depending on which service they use, right? So be prepared to pay that after the $485 US. When you get your CES evaluation completed, it will be sent to the nursing board that you applied for. You have to get your fingerprint done by the FBI. So we have cards. Normally they will send you cards, but the cards take forever to come in the mail, right? So the fingerprint screen is $44 US, and your nursing board registration, if you go with New Mexico or Illinois, is $150 US. This has to be paid, but this would be like around the 4th or the 5th month of the program, because it will take about 3 to 4 months to go to for your ECS to be approved. And then it takes about a month to get to the board and get approval. The board has to review it, your CES, and then say, okay, we accept this, and we will now require you to submit your fingerprints to be screened and pay your registration fee. When you get that done, you have to send your fingerprint cards. So your fingerprint cards, your fingerprint screen is about $44 US. That's the cost to pay to do it. But you have to send the cards. So the cards are done locally by the police officers. It's similar to the certificate or character, but you're not going to pay that $50 fee to TNT police. They are just doing your fingerprints on these cards that have been prescribed by the school and by the FBI. All right, so you get the cards, you go in, you do your fingerprints, and then you have to mail it. So the cost of mailing it is approximately $500 if you go to FedEx or to DHL. If you go to TT Post, I don't know how much it will cost. It might be cheaper, but they may take a little bit longer. When all that is done and you've been cleared by the FBI, they will get something called authorization to test. Your authorization to test is a date, a period of time. They have said, recognize that, yes, you are qualified. We recognize your qualification, and we're giving you permission to do the Nclex program. You usually have like about 6 months from the date to do it. All right. Then you have to book your flight. Your flight basically is about, when I checked it, from now to 6 months, is about $350 US, but we're not going to book it so much in advance. It depends on you. So basically about 5,000 TT. If you're staying with your relatives, what we need to do is just find a Pearson VUE that is close to your relatives, that you could take a bus, a Uber, a taxi, or a train to get there. For those of you who go in a more metropolitan area where there's going to be traffic, I will tell you not to do the 9 a.m. exam, but do the 1 p.m. exam. So you give yourself enough time to reach there, because in the morning is going to have like the morning traffic. You don't want to get there all nervous that you're running late and stuff. So take all these things into consideration when time to book the appointment. We would look at one of the Pearson VUEs that is close to where you would be staying. If you're not too sure where you're going to be staying by relatives or whatever, we'll look for a hotel close to your airport, possibly a hotel that has an airport shuttle that they will pick you up and drop you back. And we'll look for a Pearson VUE that is within a close range of that. So all those things are just logistics that can be worked out online. So as I said, tuition is 4,000 TT, and this is for the 6 to 7 month program. It consists of 6 months of tuition and questions, and then 1 month where we are going to be doing questions in preparation for the exam. So it's one thing to do your theory. We have to cram 4 years of theory from a US point of view, and then we have to learn how to answer these questions. So we have an entire class and a lesson on strategies on answering questions, right? So once you get that, it's not going to be your first lesson. It's going to be like your 3rd or 4th lesson, because we're going to do, I'll show you to you just now. I'm going to give you things that for you to start learning in order to start answering questions. And the strategies is one of the things you have to start learning, because there are certain things that you need to be aware of. So with the Nclex, whenever they present you with a question, the answer is usually based on what is going to kill the patient first, or what is going to harm the patient most if not attended to, right? They usually have 2 very wrong answers and one right answer, is in the simple case of a simple multiple choice, and one answer that is very close to the right answer. So we'll teach you strategies on how to answer it, and you have the strategies that you always go back to and look at it. So when you get questions, a lot of people spend a lot of time learning. all the materials are sent to them. And they don't spend a lot of time answering the questions. And it's in answering the question that you get that knack on how to answer questions correctly. By just looking at it, you can figure it out. Okay, and you have to do that. So basically, every time you have a class, so say we do the GI system. After the GI system, we would do all the pathological conditions of the GI systems and the medications associated with it. You get cheat sheets, and I try to make tables and flow diagrams so that you can easily look at it. Of course, it's as comprehensive as I can do it, but you have to know what challenges you have and make your short notes. So some conditions, you know it, you don't have to write, like appendicitis. All of you know how to manage appendicitis like the back of your hand, but like Hirschsprung disease and stuff like that, you may not be familiar with it, right? So make your short notes on the ones that you have. So the total cost that you're looking at is basically 875 US plus about 11,500 over a 7-month period. Okay, any questions there so far?
No, Miss Miranda, so far I understand what you're saying.
Okay, wonderful. So every week you are going to be given learning materials in a PDF version. You are required to attend classes. Feel free to ask questions in my classroom. It's a safe space. There are no stupid questions. Okay, you feel free. I encourage dialogue, right? You are required to do the questions afterwards. So if we want to do this in 6 months, there are some days that you're not going to get a whole week to do a questionnaire. You have to do your questionnaire within a 1-week period because classes will be, say, for instance, every Tuesday or every Monday, you would have a class. You have to do your questions in between. If you are serious about doing Nclex, you cannot cram for Nclex. Cramming for Nclex is sending yourself up for anxiety. And with that anxiety, you're closer to failing than passing, right? You have to be consistent. For the next 6 months, you know the type of learner you are. If you're a quick learner, if you have short-term memory or you have long-term memory. So for me, I know I don't have long-term memory. I could go in and do a quiz. I could regurgitate everything that I would have learned and come back outside and I don't know nothing. Don't ask me anything because I just emptied everything I know in that paper. So I know for myself, I prepared for Nclex in about a month and a half, right? The first 2 weeks, I spent gathering materials, making my short notes, learning the topics I didn't know, answering questions. And then for the last 4 weeks before my exam, I was doing up to 150 questions, sometimes a minimum of 75. All right. And I took my vacation and I went to the US and my kids were with me. So there were days that, of course, we can't stay home every day for me to study. So I would have to go out. So the days that I went out, the next day I had to double up on it. So my subscription, I use UWorld, and I did not have the benefit of all cheat sheets that you all will be getting. I bought that subscription for you all, right? So I basically use some of their videos on YouTube. And I used my UWorld subscription and I did it twice. And doing it twice is what is going to seal that knowledge in your head, because basically the questions is the same knowledge they're testing, but they ask it in different ways. So by the time you see that the second time around, you know what is coming. And I will tell you, some of the questions were almost identical in from UWorld. It was almost identical to the exam. Okay, so that you knew it. You just do it until, and then the ones that you get wrong the second time, you learn it off. You don't just learn off the material, you look at the key words in the questions. And this is something that we are going to be discussing when we do questions in classroom. Looking at the key words that they're asking, especially for the prioritization question. And there are certain things that I would keep saying over and over again. Even in the lectures, make your short notes because I will keep giving you examples. Make your short notes. Don't just sit down and listen. Have your pen and your paper and make your short notes. And I will keep repeating certain things when we do the priority questions so that from the time you see the question, so say for instance, not all priority questions are ABCs, meaning airway, breathing, circulation. Right? One of the things that you need to learn is anybody with an altered GCS, they take priority. Any patient who has altered sensorium, altered levels of consciousness, unconscious, GCS of 8 or less. Those are the patients that you need to give priority to, because there is a little rhyme. A GCS less than 8, you need to intubate, because that patient can no longer keep a patent airway and cannot be trusted to breathe on their own. So we intubate in order to keep that patent airway and to oxygenate the patient. So for instance, if you had a question with a patient, which patient you will do priority care for? Is it the patient with an altered level of consciousness, a patient who has a fractured ankle, a patient who has a laceration to the lower limb that is bleeding, or a patient who has SpO2 of 89% and wheezing? All of those sound like you're supposed to be attending to, right? The wheezing patient has 89%, we need to attend to that patient. But that patient still has a patent airway. The bleeding patient, they didn't say anything about arterial involvement. They didn't say anything that the patient is unconscious or showing signs of shock. Do not read more into the question that they give you. A lot of people like to say that Nclex is vague. It's not vague. It is trying to get you to the right answer. They give you the information to make the choice. So they say the patient has altered level of consciousness with a GCS of 7. That's the one that you are going to pay attention to, right? And this is what they want. They would only give you the information that is necessary to answer the question. Do not read into it, well, maybe this is a child. They might say a child with a fractured ankle. And you start thinking, okay, well, children are supposed to be seen first. That child is breathing. They did not indicate the child was in any way in distress. Okay? Any questions so far?
No, Miss Miranda, I understand everything so far.
All right, great. We move on. So this is your course outline. Your first lesson, you're going to be given what is called a cheat sheet. So basically, this have everything that you need to do. So lab values are not going to be tested the way they were tested before. Okay, so but you still have to know it. You are going to be practicing in US. So the things that you need to know is like your metabolic panel. You need to know that. You need to know your electrolyte value. You need to know things like the HIV, the normal viral load and abnormal viral load. You need to know drug toxicity levels, therapeutic and toxicity levels, for instance, like the dioxin, theophylline, the psych drugs. You have to know it. So I'm giving you this cheat sheets, the type of diet, soft diet, and your diet's a little more, well, I'm not familiar with what diets we use in the ward setting in the hospitals, but there are certain types of diets that the US will describe slightly different. It's all in this. So once you get this, every day, if you learn 2 or 3 things off of this, is 2 or 3 more than you knew the day before. Okay, and it is going to help you in your practice. As I said, you have to be eating, breathing, living Nclex to pass Nclex. You see, on your lunchtime, take your lunch. Pull out your phone, save some screenshot of something that you have to learn for the day, or walk with your paper in your lunch bag when you print it out and learn something different, write it out. When you're doing something like washing the dishes or turning your pot, try to recall it to your memory, what it is you learned for the day until it becomes second nature to you, right? So things like your cranial nerves, that is something that you're going to have to know, because when we do the neurological system, they tend to ask you which nerve is affected with a stroke, right? Parts of the brain, which part of the brain is affected, which part of the brain affects speech, affects walking, affects concrete thinking, all right? All of this you have to learn. But if you take 2 or 3 things per day, you don't have to learn all of it. So for instance, when I had to write my exam, we had to know all of the lab values, which was like 20 something values. So what I did, I just kind of created a table, and every day I would write the lab values, all of it. Sometimes I will get middle one wrong, the end one wrong. I can't remember it, but you do it every single day until you get it right. So you have your cheat sheet, try to remember it, start during the day. You know, you're driving, try to bring to mind what it is you learn and write it down. Sometimes when you write it down, it kind of seals it into your head. You know, it becomes second. You know, they talk about muscle memory. It becomes your muscle memory. So after we do that cheat sheet, we're going to start psychiatric conditions and medications. Why? Because most of you don't have a lot of psych experience, or you're not psych trained, right? With psychiatric nursing, they test mostly the medication than the pathology of the conditions. They do the dangers of the drugs, the side effects, they look at therapeutic communication. You might get one or two questions like the schizophrenic patient and stuff like that, but it's not a whole lot of pathology. You don't get pathophys in Nclex very much. You might get one or two there. And then when you do the endocrine system, because of the hormones and how the hormones are released and one hormone influencing the other, like the thyroid gland with T3, T4 and stuff, that is where you do your pathology and the questions would come. Right, the pathophys would come there. Other than that, it's more nursing care. Well, I'll show you the various areas they break it down into. After the psychiatric condition, we will do the neurological system. Why? Because, again, that's a very difficult topic, and the medications are closely related to the psychiatric condition medications, right? So we cover those two things. Those are drugs acting on the brain. And we then move on to the fundamentals of nursing, where we're going to look at the ethical, legal, the cultural differences, as well as medication administration and stuff like that. And then after we finish that, that's an easy topic. So we take two hard topics out of the way, the psych and the neuro, and then we do fundamentals. There are just a few things that you would have to add to your knowledge base as compared to your fundamentals in Trinidad when it comes to the ethical, legal, as well as the cultural differences. When we finish all of that, we start on maternity, antepartum, labor, delivery, and postpartum care, as well as the newborn, right? A lot of you don't have experience in that, so we're starting there. We cover the hard topics first, so you have enough time from the beginning to the end of the program to learn the things that you don't know. I am going to give you documents, Google Docs with questions. Normally, I would leave it the first time. You have to do it, and you could repeat it, right? I would probably just leave it open so you could do multiple responses. Now, when we do the topic, it is in your best interest to do the questions soon after. All right? Once that has been presented to you, if you need a certain area you need to review, feel free to go and review it, but do your questions. Your questions is going to give you, when you answer it, it's going to give you the rationales. If whether you get it right, it may make a lucky guess, you're going to get the rationale. If you get it wrong, you still get the rationales so that you can see where your thinking went wrong. When you do get it wrong, again, I would advise you go back and look for the key words. You may know your topic, but what were the key words that you missed, that you chose the wrong answer? So a lot of people, you see them in all the chat groups and they're using every single available resource to them, Marquee, Archer, You Will, and they're still failing. It's because they're not looking at the keywords and they're not using their strategies, or maybe they're not aware. If they did Marquee, they would have some strategies, all right? After maternity, we're going to do the newborn. We're going to look at assessment, developmental milestones, their vital signs, importance of play, and theories, Piaget, Eric, and Freud. We're going to look at those theories when we do that newborn assessment. And then we kick off with pediatric conditions. We do the congenital, such as the cardiac diseases first. We look at genetic, respiratory, endocrine. Each one of the systems, we look at it individually because children tend to have some of the conditions that are not covered in the adult section. After we do the children, we go into the medical surgical conditions and procedures and skills, and we have a class on ECGs and critical care that we're going to do as well. I forget to add it in there. And then your 1 month, we're going to do UL questions for Nclex. So during the period that you are in class with me for the 6 months, you're going to be getting questions from Saunders, from Simple Nursing, as well as from UL. So you have 3 resources combined. All right. So basically, you'd be doing 5,000 questions, and it's going to ask you all manner of questions in all formats. You select all that apply, all the new gen questions. We're going to do it. right? In some of the classes, in some of the questions, I've included the new generation questions, but usually it has so much that we would save the new generation questions for a special class when we're doing questions, right? Because we want to build on your knowledge. The new generation question, they tend to look at the patient as a whole. So say, for instance, like you have a patient admitted to the ward, they would give you the history that the patient came with, the vital signs, and the doctor's orders with the medication and whatever. And then they will give you certain questions about what to expect next or what you expect when you give this medication and stuff. But we'll go more into that later on. All right. So again, this is just the things that I mentioned. We use UWorld, Marquis, Simple Nursing, and Saunders, and you're given the PDF version of it. So why do Nclex on your own? So a lot of agencies are coming to Trinidad and they either being picky or they grab you up, right? Now they are investing money into you to do Nclex. I think they pay for it once for you, maybe twice some agencies. If you fail, you have to pay them back because they're investing with you. So they would do tuition. Some of them just send you like a UWorld or Archer subscription, and you have to teach yourself. When you attend my classes, you would see that we use a lot of Simple Nursing with their cheat sheets. It's easy to remember. Everything is highlighted so that you would see what is an Nclex tip, what Nclex is looking for, right? Now, having done Nclex on your own, you could approach any agency. They no longer have to invest in you and hope that you pass your exam. You are now a prime commodity for them because you are an Nclex nurse. So they would pay you bonuses. Some people went up to 10,000 bonuses. However, don't just look at the bonus. Your basic rate of pay is important, right? So some people started at 32. I remember when I started with MedPro in 2016, they offered me $28. And then by 2019 or 20, just before COVID, they had only gone up to by 32 to $32, $4. Right, so in 4 years they just rose by $4. A van 2 was offering 32. I think eventually they went up to 34. So you doing Nclex on your own, you get to choose your agency and you just get to negotiate your terms and conditions of pay. All right. With this, I put it move at your own pace of study. I would still like you to move with the group, right? I do not benefit like an agency would benefit if you pass your exam or not, but I want you to stay with the group and study. But I know we have families and I know we have work and work can be pretty demanding, but stay with the pace. Don't fall. If you see you miss a class, make up for it the next day. The classes are recorded and it's sent to you. It's on a YouTube channel that would be open to you to use. All right, the lessons that you had will be sent to you on an open YouTube channel and video that you can look at it. You can listen to it when you're going in the car. You can put it on your phone when you're washing the dishes. All these things I would do because I was working before I took that month off vacation to go write the exam. I would be walking for my exercise and I would put on a video and listen to it on a particular topic that I wasn't too sure about, okay? Disadvantages, of course, the cost is going to be your own, but if you should sign up with an agency that is offering you a higher rate of pay as well as a bonus, it more than justifies you putting all that money and investing into yourself. So like a lot of agency, like for instance, I think O'Grady is very, very particular. I just got fed up with them and I think it was me getting fed up with them was the reason that I did Nclex on my own and I didn't regret it because they want this, they want that. I mean, I so highly skilled and trained and I think they just think it was on paper. But after having like 30 years experience in nursing, I don't know what more they wanted. So basically I got fed up with them and I did it on my own. Before we get into that, how did I get into teaching Nclex? So I do a lot of teaching in my hospitals when I work in the emergency department and wherever I work, I do a lot of teaching. And some of my colleagues knew that I went and I did Nclex on my own and they wanted to do it as well because the agency didn't pick them up or they just did not want to be stressed with having to follow rules and regulations with the agency in a particular time frame. So they approached me and they asked me to do Nclex with them. So I would have had quite a few students. Some of the students just wanted the materials and the tuition, and they did attend classes, but they choose not to do Nclex just yet. I've had 4 students who were with me do Nclex, and I've had 3 of them pass. Right? The one that didn't pass did not do as I told her. Because when I kept in contact with her, and I think we are all adult learners, that I don't have to go check your score or check what you're doing or check that you did the questionnaire. I send the questionnaire to you all. You all are adult learners. You are paying your money and investing in yourself. It is in your interest to do the questions. It's the only way to pass NCLEX, not studying the material, but doing the questions. And when I was going through all of the questions that I would have sent her, all of the questionnaires I would have sent her in preparation for NCLEX, she didn't do half of them. And I kept in communication with her. I said, are you studying? Did you do your questions? What challenges are you having? But I can't make her do the questions. Right? So when she failed now, when I went back to analyze her report and her questionnaires, is because she didn't do some of them. So when I send it to you, you mightn't get to do it at the same time, but it's there for you. Please do it. Put aside 2 hours for the day. If you were at the University of West Indies and you had to go to classes, you had to drive to UE, sit down in a classroom for 2 to 3 hours, and then drive back home wherever you're living. Right? We are making it on Zoom that is convenient to you. You can do it. And we are recording the class. So if you can't attend classes or you want to re-listen to the recording, it is available to you. But again, the questionnaires are sent to you. Please do it. Okay? So sorry. So the NCLEX exam, we're going to talk about that now. And for those of you who have done it or haven't done it, is a computer adaptive testing. It adapts to you. It tests your knowledge, right? No 2 persons would have the same question. It might start off with the same questions, but it doesn't go the same way for them. NCLEX has hundreds of thousands of questions. And if you ever have to sit through Nclex, they don't repeat the same questions they had. They have a record of the questions that was sent to you before. They're not going to give you the same questions. It will never appear twice. All right. So the questions, you don't want to be the brightest students, because the brighter you are, the harder the questions get. But you don't want to be the slowest student, because then they will keep bringing you questions on a particular topic, and then you would run out of questions by 150. Before, it used to be 5-hour long exam and you had up to 300 questions. But because of COVID and the challenges of COVID, they have reduced it to 3 hours and 150 questions. You are allowed to take a break. All right, but don't take too long of a break. Your time is ticking. Now, each question determines the difficulty of the next question, as I said. Correct answers will make the next question slightly harder, while an incorrect answer, you would get an easier question. They're going to test you. So say, for instance, you got a question on infection and control wrong, they're going to bring back another one for you. Right? And if they thought that was harder, they will bring back a simpler question for you. Sometimes they repeat questions because they might have like a test question. So for me, I would have passed my exam in a minimum of 75 questions, but there were 2 questions that were the same. The answer would have been the same, but they ask it in different ways. And they really ask about the definition of a hospice, right? So I thought, okay, well, I got the first one wrong. Let me choose another answer. When I started teaching NCLEX, I realized these are test questions that they put in. Now, your goal is to achieve and maintain a certain level of difficulty so that the computer, a logarithm, can evaluate your knowledge level. As I say, if you're bright, you're going to keep bringing hard questions. You just want to score average. And for me, I'm an average student. I'm not extremely intelligent. I think I'm like a B+. For me to get an A, I would have to put a little bit of effort into it. So I am an average person, right? And I would have put in the work and I would have passed NCLEX on my first try on a minimum of 75 questions. Now with NCLEX new generation, with the old NCLEX, you had your SATA questions. If the starter questions had 3 possible answers and you only got 2, you get the whole question wrong. If it had 3 answers and you choose 4, you got the whole question wrong. With new generation Nclex, you get partial points for it. So if the question had 2 answers and you choose 3, so say for instance that that would have carried 3 points, 2 points because the answer was 2 possible answers, but you chose a third one, they will minus 1 of the points. So unless you absolutely know that this is the answer, don't choose it because it will minus. If it was 3 possible points and you get 2, and you choose 2, you get 2 points for that. Right? You just don't get the third point. Understand?
Yes.
Okay. So we did the select all apply, right? Then you have your simple multiple choice. So in all Nclex, you would have 75 questions on 75 different case scenarios, right? Each question had a own history of itself. But in new generation Nclex, you have maybe 5 or 6 questions occurring on the same patient. And it helps you to easier to figure out it because they give you a history, they give you vital signs, they give you treatment, and then it's the what next. So they're begging you to pass Nclex, right? They make it a little bit easier for you. So say, for instance, you don't just treat somebody in a vacuum on the ward, right? You have a patient, you take over the history, you take over the treatment plan, you take over what was done, what was the blood reports, right? And basically that is what new generation Nclex is. So they give you a certain amount of information and you have to make deductions or inferences or what happens next. You know, like Sesame Street, what happens if I pop this balloon? Well, what happens when I give this patient deduction? What toxicity level do I have to look for, right? Over a long-term period of time. So it gives you a sense of where you are instead of answering 75 questions in a vacuum. Now, the hotspot, they will give you a picture, like say, for instance, they would give you the torso of a human being, they would put the rib cage and the heart and the lungs, and they would ask you to point where would you find the apical pulse, right? So you have to put the X on that particular spot where you find the pulse. The fill in the blanks again is an enter free text that must be correct, and this will be in numbers such as a dose calculation. So they will give you the a patient is on 50 milligrams of Olfen IM, but the vial comes in 75 milligram in 3 mils. How many mils would you administer the patient? And they would tell you if it's 1 decimal point or 2 decimal point. Make sure and read your decimal points. If they say round it off, remember if it's 0.5 or more, you add 1 to the whole number. If it's 0.4 or less, you don't add anything. You're all familiar with that, right? So those are your dose calculation. Then you have your drag and drop, which is used to order answers. So they would ask you, for instance, they will put several options. How would you put on a pair of sterile gloves? Do you put it on your right hand first? I place the glove on my right hand first. Next, I place it on the left hand with the cuff and whatever. You now have to put what happens first, or they might do it like a urinary catheterization, you know, swab the perineal area or the genitals with Savlon, then with a sterile hand or non-sterile hand, hold the catheter. You have to put it in the sequence, right? We have questions like that, so you get to practice it. Then you have the charts or graphics question, which consists of an image as well as a text. Example, the heart rhythms. You will get a heart rhythm because a heart rhythm tells you if your patient is going to live or your patient is going to die. So some of the heart rhythms would get bradycardia, normal sinus rhythm, sinus tachycardia, SVT, torsades de points, ventricular fibrillation, ventricular tachycardia. Don't get panicked that you don't know it. We're going to know all of this before you write exam, right? Then you have the graphic multiple choice, which is the same as the normal multiple choice, but they use graphic and images as answers instead of a text, right? So they might give you a picture of something and you have to choose it. So say, for instance, like when you're looking at the fetal heart rate monitoring in maternity. They will give you a picture and ask you which one of these is the priority patient. Okay, then you have audio, video where they play you something, or you have to press on the arrow and a video or a sound. Usually this comes with the long sounds, right? You're not guaranteed a long sound, but you're guaranteed an ECG rhythm, okay? So they have reviewed how people have been performing on this test, and that is why they brought back the new generation, as I did all the explanation about the total patient care instead of having 75 vacuum questions, right? And they're realizing that nurses are caring for more and more critically ill patients, and they are unable to do so, leading to more deaths. So that's why they focus the questions for Nclex more on critically ill patients. So when I tell you, when the answer should consist of what kills the patient first or what makes the patients most seriously ill, that is the answer they're looking for, okay? This is just some additional information about it. So this is the areas that you are going to be tested on. Safety, safe and effective care environment, and this will concern of management of care as well as safety and infection control. And when you get your questionnaires, they are all divided into these categories. So when you are analyzing, don't just do it, analyze which area you're weak in. Is it infection and safety control? Is it physiological or psychosocial integrity, right? Is it health promotion and maintenance? So as I said, is what kill or harms the patient first. So you see, management of care is up to 15 to 21% of your exam. Safety and infection control, 10 to 16%. And you would hear me saying things over and over and over to get it into your head. So when you see say, for instance, seizure preventative measures. Automatically, when you hear that, you don't be wondering what it is. It's a padded bedside, right? Padded bed rails, oxygen, suction, and possible intubation tray. Those things are your safety measures for seizure precautions, okay? So it comes in your mind one time. The health promotion and health maintenance, as well as psychosocial integrity, is between 6 and 12%. When we go to physiological integrity, your basic care and comfort is another 6 to 12%, but pharmacology and parenteral therapies is 13 to 19%, because they always look at drug interactions, therapeutic doses, what drug you're going to give. When you give digoxin, you have to count for 60 seconds, right? Never 15 seconds like we tend to do in real practice. They want to see that. So they will even put it in an Nclex question, check the pulse for 45 seconds. If you see 45 seconds, that's not the answer. It's 60 seconds, and they will trick you like that. So when you think you answer these questions really good, yes, check the pulse, but you didn't see the part that says check the pulse for 45 seconds. I used to make those mistakes in the beginning, but Nclex is quite specific, and you have to look at the key words. So once you rule out those two obviously wrong answers, and you have your two close answers, the right one and the one that's close to it, look at those key words, because the Nclex will try to trick you. The reduction of risk potential is 9 to 15%, and then another large area is physiological adaptation. And you will see each one of them in the questions when we go through them. So again, we talk about the computer adaptive testing. This is just the same information I would have presented to you before. So how do they decide if you pass or fail? Right? So the decision really as to whether a candidate passes or fails the exam is governed by three scenarios, right? The first one is the 95% confidence interval. The second one, the maximum length exam. And the third one is your run out of time rule. So in the 95% interval, confidence interval, this is what most Nclex candidates are judged by. So the computer will stop administering items when it is 95% certain that you know yourself. right? So they don't really give you a passing grade or anything like that, like 75% or 6%. But when I was doing my Nclex, I was making like between 75 and 80%. And then when I did my computer adaptive testing, it said a high chance of passing, right? So again, as you see, I was not an A student. I'm a B plus for the best, okay? So this is the rule: when the 95% sure you know your stuff, that they're going to pass you. Then the scenario 2, or the maximum length, you have 3 hours. So some candidates' ability levels would be very close to the passing standard. And when this is the case, the computer will continue to administer questions up to the time that it reaches 150. At this point, it disregards the 95% confidence rule and it considers the final ability estimate, which is it above the passing standard, you will pass. If it is below the passing standard, you would fail, right? So you reach your 3 hours, you might get 148 or 149, and you had one more question, but you run out of time. They would use this to look at what questions you answered. If you do run out of time before you reach the 150, and it has not been able to decide whether you've passed with a 9 or failed with a 95% certainty, there are other rules. So if the candidate has not answered the minimum number of items, the result will be failing. So if you take 3 hours and you did not answer the minimum of 85 questions, they're going to fail you, right? So this is why you need to practice. A multiple choice question is supposed to take about 1.5 minutes for the most, right? If you know the answer, therefore you answer it in less than 1 minute, you shave a few seconds off of that for the ones that you don't really know and you need to spend time on, right? So know the majority of your content. If the candidate has answered the minimum number of items, and then the exam is scored by using the final ability estimate computed from the responses to all the completed items, right? If the final ability estimate is above passing, you pass. If it's below, you fail. So you all who would have been looking at the blogs and the social media pages, you know that you get your quick results within 48 hours and you have the Pearson VUE trick done and whatever. It's all over the internet, right? And then some people will get saying that the candidate has sat the exam, but it's pending. It's because it's pending on these rules, the maximum length or the run out of time rule, right? And they would spend some time, but usually you get the positive result within 48 hours. They send you an email or you get it from your nursing board that you passed. So occasionally, as I said, you would get items that are similar, like how I told you the definition for the hospice. It doesn't mean that you didn't answer the first question correctly, like I thought. It's just a test question, right? That they probably pre-testing. When you go into your exam too, at the end of the exam, they ask you to do, I think, about 10 questions. And they say it's test questions. You're not obligated to do it, but they would like if you to do it. Again, depending on your mental state of mind, just leave the people room. You know, I sat down and I did 1 or 2, and I was actually reading these things to answer it honestly, but I was in shock because I didn't know how I performed in my exam. I'm a quick tester in that my exam finished in just over an hour, right? But that's the sort of person I am. If I tend to mull on a multiple choice, I will choose the wrong answer. I have learned to just go with my gut feeling. If I don't know it, just go with my gut feeling and don't ponder on it. But that is me. I have friends who just mull over the answer and choose the right one, and that works for them, right? So if you're not in the mood to answer the people questions, just ask to leave. You're not obligated to do those last 10 questions, because the lady saw I was struggling and she just said, you can leave, you don't have to go. And I was just glad because I wanted to go in the washroom and cry because I really thought I didn't pass. Because I was looking at I didn't realize I was moving through the exam so fast. And I think when I reached like 60 something, I made a conscious effort to slow down because I'm looking at my time as well. And you can't go back to a question. And I'm thinking, I knew there was some that I may not have answered because I got a particular drug that I never heard about. is a drug that they use for asthma now in Trinidad and Montel, cast or something. At that point in time, I didn't know it. And of course, I guessed it wrong. And then there was another drug. They gave me the generic name, I think, for one of the vitamins, niacinamide. And I was like, what the hell is this? What drug is this? I just didn't know it. But when I looked at the options for that particular one, the only thing that will kill or harm the patient was liver damage. So I chose that answer and it happened to be right. So even when you don't know the answer, look for the answer that says it's going to kill or damage the patient first and choose that one. That was my strategy then. It looked like the only feasible one. So take your time, do your questions. Again, as I said, I thought I was failing. And then when I reached 70, I was like, okay, don't worry, Miranda. You have, I forget how much, 300 questions or how much then, or 150. I can't remember how much I had. Don't worry, you're still in the game. And that's what you keep telling yourself. I'm still in the game. Once that computer keep bringing questions for you, you're still in the game. They are begging you to pass, right? So don't give up. Know the type of tester you are. And I would keep saying again, practice your questions. It is what is going to give you that cutting edge. Again, guessing. Do not guess by playing any, mini, miny, mo. That is not going to work for you because it's going to throw off the algorithm and it can be disastrous for you. So the best advice is, one, maintain a reasonable pace, spending no more than 1 to 2 minutes on each item. For the items that you know, good. Don't spend a whole minute and two on that item. Answer it and move on because you're going to get questions you need to mull over, right? Number two, carefully read and consider each item before answering. Again, look at your keywords. When your priority questions come, don't think ABCs is the only thing, or always the first thing is altered level of consciousness and all else after that. All right. Now, the new generation Nclex questions, you have the case scenarios. They normally have 2 to 8 questions in the case scenarios from a single case, provided you're provided with the case patient record. So they will give you like different tabs and you have to click on the tab in order to get the information. You don't have a pen and a paper, so you have to learn to use the computer, right? And you have the screen split. So you have different tabs on the left-hand side of your screen. You have a line down the middle of the screen. On the left-hand side, you have different tabs. You'd have a square with different tabs when you click on the tab. So the first tab would have the history the patient come in with the vital signs and whatever. The second tab might have the doctor's orders. The third tab would have the blood results, right? And then all the question that comes after deals with the information that you have been given. You have the extended select all apply. These are longer select all apply, and they will have up to 8 answers. Now remember, you're getting partial credit for the answers that are correct. If you're not sure that the answer is a particular one, don't choose it because it minuses from your correct answer. Then you have the drop boxes where there's a box with an arrow, and when you click on the arrow, it essentially is a cross between the multiple choice and fill in the blank. So they will say, which of the following conditions is associated with intestinal obstruction? And they would give you like vomiting, constipation. You know, they would give 3 things and you would have to choose one of it. The extended drag and drop again is the traditional drag and drop, except that there will be more answers and more spaces, right? So remember, I tell you about the drag and drop, it would give you, for instance, putting on your glove or taking a culture or specimen. They like to ask about the stool specimen, how you take the stool specimen and do the slide. I can't, it's not the occult blood. It's one of the tests that we do for GI, which we will cover. Then you have highlight the text. So these questions will be answered by highlighting an area of the text in a given passage. So you have a passage, it's all black and white. And when you put the cursor over it, it would highlight in yellow certain words, right? So they would ask you, they would give you the history of the patient. A patient came in with blood pressure 90/60, pulse 110, respiratory 15, complaining of right lower abdominal pain by 3 days. Patient has a history of constipation and vomiting or diarrhea and vomiting. And they would ask you to click and highlight which is the important or the abnormal observations and assessment. Obviously, blood pressure was low, right? The pulse was tachycardic, respiration was normal, and that right iliac fossa pain. I didn't put all that details, but the right abdominal contract pain, right? So those are the things that you would look for the highlight and text, and we'll have some examples later on. Then you have the matrix and grid, which is like the select all apply questions, but is either you select or you don't select, right? Is either something going to happen or it's not going to happen. We're going to see some of the questions like that. So scoring. The standard questions from the own Nclex, including the fill in the blank, the multiple choice, select all that apply, and a hotspot will continue to be worth 1 point. However, in the multiple response question, will receive partial scoring. So say, for instance, it has 4 answers, you will get 0.25 of a point. But everything adds up. In the new gen questions, partial credit is now given 3 ways, called the dyad scoring and the triad scoring. So you have scoring, lets the test takers earn 1 point for each correct response, but lose 1 for the incorrect, as I keep telling you, right? So the final score can be 0 if it was two possible answers and you choose 3. In this system, the points are not deleted for incorrect response. In this system, points it's supposed to be points are deleted for incorrect responses. Sorry about that. And okay, that's for regular scoring, right? But in the dyad scoring, so you know in CXC they will tell you, don't worry, answer all the questions. Even if you choose a wrong answer, it's not going to take away from your score. That's regular scoring. But we are now using the dyad and the triad scoring with the NGN. So dyad scoring, the test takers take 1 point if both answers is in a paired set are correct. In triad scoring, they get 1 point for each correct answer. And if all 3 are correct, the test taker gets 2 points. Okay, so that's the difference between regular multiple choice scoring and the dyad and triad. You all understand this? Understood? Is this part understood with the scoring system? Hello?
Yes.
Okay.
Yeah.
All right. So any questions so far? None. None at all?
No.
Okay, so we move on. So this is just about NG, and again, the clinical judgment model. So you know everything is a theory. They don't just form an exam. There's a theory behind it, right? And it's the clinical judgment or the clinical judgment model that they use in order to create these questions. So they didn't just pull questions out of the air. There is a theory behind it. Okay. So the literature review found that 50% of nurses were involved, novice nurses were involved in nursing errors, and 65% of the errors was poor clinical decision-making, and the 20% of the employers satisfied with clinical decision-making skills of the novice nurse. And even though we have some experience in our belt, me with all my 30 years going there will be a novice nurse, right? Just as you are. So in summary, we use the clinical judgment as necessary skill for the novice nurse. Client care and its errors can be improved by enhancing clinical judgment skills in novice nurses. There's a clear need for direct, extensive, and explicit assessment of this construct in the entry-level nurses, and assessing clinical judgment is a critical component of the overall goal of Nclex, ascertaining minimum competency. And finally, clinical judgment currently is indirectly tested in a limited manner through the integration across activity statements. And this is what they found when they examined nurses who would have passed the novice nurses in their exam. They found they were lacking in certain areas. So the clinical judgment model frameworks, the 3 predominant nursing theoretical frameworks is the intuitive humanistic model by Benner, and you have the dual process reasoning theory model, as well as the information processing model. So the actual nursing clinical judgment is difficult to define, but we look at the nursing process overview where we have assessment, we make a diagnosis, we plan, we implement, and we evaluate. And all this is part of our critical thinking and clinical decision-making process, right? So in the clinical judgment model, it is defined as observed outcome of critical thinking and decision-making, and it is an iterative process that uses nursing knowledge to observe. So you're observing a vital sign, you're observing a patient's condition, the signs and symptoms, assessing presenting situations, and identifying a prioritized client concern, and generate the best possible evidence-based solution in order to deliver safe client care. Anybody confused by that? No?
No.
Right? So it's basically observing the client and knowing what next to do. Okay? This is just the diagram of how they do it, the different layers. So again, you have here your nascent process, your assessment, analysis, planning, implementation, and evaluation. So you'll be able to, on assessment, recognize cues, analyze the cues. So you recognize this patient is is tachypneic, right? You analyze the cues, you prioritize your hypotheses. So you see a patient coming, he looking diaphoretic, cyanose, and tachypneic, right? When you analyze that cues, you come up with the hypothesis that this person appears to be having an MI. So if he's having an MI, one of the first things I want to do is get him in a resting position, like bed, in an upright position, high Fowler's, and start that oxygen therapy, high flow, immediately, because the patient is short of breath and diaphoretic and has chest pain, right? So you generate this hypothesis that he has a MI, so I need to get him in a bed and start oxygen and vital sign and get an ECG done. So we generate those solutions, we start doing it. When I put him in bed and I start that oxygen, what happens? Has the oxygenation improved? Did I put him on a nasal cannula and he needs a rebreather mask, right? You need to analyze that. When I did the ECG, what happens next? Do we call the doctor? We get him ready for strapping and whatever. Okay, so you see how it presents there. So in layer 3, this layer provides the assessment elements, and the NG and clinical model items are written to address it. So I would have just given you that scenario there. Again, the same thing in a different form, right? You take and you implement your solution, and then you compare the observed outcome against the expected outcome. So say you started the oxygen on a nasal cannula, and you realize, wait, his sat only going up by 2%, and this man's still heaving. I need to get that non-rebreather mask, which give him a higher percentage of oxygen, okay? Level 4, again, this is the environment, the patient, observation, medical records, pressure, time pressure, knowledge, skill, specialty, experience, your resources, time pressure. So this layer provides the context. The white bubbles correspond to the external factors such as the environment, the patient observation, the medical records, and the time pressure, right? And the gray bubbles correspond to the internal factors such as the nurse's knowledge and experience, right? You wouldn't send a midwife in an ICU setting, right? You have to know their specialty. And then applying the clinical judgment task model in the education, the cognitive layer is layer 3, which we talked about. The factor condition is layer 4, and expected behaviors and action is what is the appropriate student action or observable outcomes. So basically, the model assesses if the student is able to make the appropriate nursing clinical judgment by following the cognitive operations through an entire case study. And this is just in a table in another form. So these are the type of questions that you're going to get, right? So sorry for the slide, it could not be better than that. So you see how you have a tab here? So this is your nurse's notes. So this is similar to exhibits in the current RN exam and presents information about the client. So this is a single tab. Again, this is how you get your split screen. So can the students identify the most important information? So the client findings, the vital signs, long sounds and stuff. And this is, you have to drag it here, the top 4 findings. So you're looking at the history. Client was brought to the ED by her daughter due to increased shortness of breath. It's kind of bad. So basically you have to pull out from here, which is the 4 top findings. So characteristics of the course, the patient orientation, radial pulse. When you see this, you would be able to guess which one it was, right? Then this is the one that, so they give you this question now about the vital signs and the signs and symptoms, and you have to say if it's the fever, if you suspect pneumonia, a UTI, or if you suspect is influenza, right? Confusion, if it's pneumonia, UTI, or influenza. Body, I'm so sorry about the quality of this slide. Cough and sputum, would you expect it to be pneumonia or UTI or influenza? Obviously, you're not going to choose a UTI, which is a urinary tract infection, for a cough and a sputum, right? So you could suspect a pneumonia and you can suspect an influenza. And then the shortness of breath, of course, you're not going to choose the UTI. You don't have shortness of breath in that, right? Do not think, okay, well, UTI, this patient must be going into septic shock and the lungs failing and they're going into heart failure. So therefore, yeah, they might have, they didn't tell you all of that, right? Again, just look at what information was presented to you. Do not read more that was given into you. Again, this is the drop-down box. So the chest is at highest risk for developing. You press on this, it will give you as evidenced by the clients, right? So you might be developing atelectasis as evidenced by the client's inability to breathe. Something like that. But when you press on the arrow here, it will give you options. So basically, it's helping you to make a nursing diagnosis. This one is the select that apply. Again, this one is a multiple selection. The client is at highest risk for developing, or this is the same one, right? So you would have hypoxia, stroke, dysrhythmias, or a pulmonary something, embolism, as evidenced by the patient's vital signs, neurological assessment, respiratory assessment, or cardiovascular assessment, right? So it could be hypoxia as evidenced by the respiratory assessment, right? If we're talking about this patient who is having shortness of breath. Then this is a different type of questions now, indicated, non-essential, contraindicated. So should we prepare the patient for defibrillation? Is this a cardiac patient who is having a dysrhythmia? So you would see this information came at 10 o'clock, and then they added some more information for you as the case study went on. You get a new tab. So you press your next question here, sorry, and they give you some more information at 12, was called to bedside by daughter who something that the mother isn't acting right, who states the mother wasn't acting right. Upon assessment, client difficult to arouse, pale, and diaphoretic in parents. So should we prepare for defibrillation? Is it indicated, non-essential, or contraindicated? Is the patient in the semi-fowler's position? Should that person be in a semi-fowler? Because she was diaphoretic. Somewhere it says she was difficult to arouse. So we're not going to put her in a high or fowler. She wouldn't be able to maintain a high fowlers. So that will be contraindicated or non-essential. So you have to choose which one of these, okay? And this is the highlight the question. So the nurse has received orders from the physician. Click on the highlighted areas below the orders that the nurse should perform right away. So should we put on a catheter first, or should we give vancomycin first, right? So obviously you click on the highlighted ones that you think you would do. So we would start the vancomycin, start the sodium chloride IV, and do your blood culture. So obviously your blood culture would always have to be done before you start your vancomycin. This is another one where you simply put if it's improved, no change, or declined. Right? You just choose if the respiratory rate, was it improved, no change, or declined. You see how simple they would make it for you. And again, it takes you back to your nursing practice that you would have experienced and how you manage your patients instead of giving you vacuum question. This is the same question. So again, the new gen presents real-world nursing situations and measures the ability to identify, analyze, and synthesize the most relevant information into appropriate nursing interventions and are prioritized based on the client needs, selected and performed correctly, and then evaluated for effectiveness. So your case studies would basically have about 6 to 8 items. The orders of items will always match the order of the sample set. So sometimes when you have to do order, they will give you 6 options and you have to choose 6 options. And sometimes it would have 7 options and you have to choose 5. All right. We talked about this already. And this is just a short video for you all. I will leave this for you all in the link. This is an hour and 30 minutes and it's basic. I'm sorry,
Hi,
it's
I'm
31
Melanie from
minutes. It's from UWorld and it's basically telling you the same things I told you about the questions like the bow tie and stuff. So I will copy the link. Well, you all would have this and you could just copy the link and look at it. Okay, because it's 31 minutes long. What's the time now? Anybody can give me a time? 8:22. Do you all have the 30 minutes to listen to it now? Anyone still there?
Yes, I am here.
Okay.
Yes, I am here.
All right,
Hello?
great. So, yeah, okay, I hear you. We'll listen to
Okay.
it.
UWorld. We're looking at next gen practice questions from the UWorld question banks. Alrighty, so looking at an actual NGN style case study from UWorld here. What I want to start talking about first is the clinical judgment measurement model. It serves as the foundation for all of this
Okay, so we
NGN
went
new
through
style
all of
content.
this. I want to
But
go
having
through
some
it.
minimal icons will help. You
I
can
just
walk
want to go to the
any of clinical
questions.
judgment questions in a case study. So let me flip. We can tell they're in the emergency department. It tells us that it's 8 a.m., 800 hours. That may or may not be important. And then we can see here the client has come in due to fear of having a heart attack. Heart attacks, of course, are, one of the most emergency conditions you can walk in with. The client states, I was taking a bus from home. We'll just kind of read it over briefly here. Chest tightness, they had some help. And there's some fear here of what happens next time if they can't find help. And then they're saying that they have had some similar experiences recently. It's kind of random, and they're afraid of what's going to happen if it happens again and if they'll have help. So then looking over, of course, we have a lot of clinical data here. So we're going to go from the nurse's notes tab and make sure we're looking at all the information. Here's the history and physical tab. This has a lot of helpful information in it. So these are typically written by your healthcare provider here. And this is going to tell us a lot about their physical symptoms. So generally, we can see that this client, even though we're not looking at them, we can tell from the notes that they are well groomed, taking care of themselves, but having some minimal eye contact and appearing fidgety, tearful, a flat affect, which is something that can be associated with depression, some other conditions. So definitely maybe some mental health issues here we want to be sensitive to. The client is trembling. The thought process is logical. That's helpful to know. And no reports of suicidal or homicidal ideations. That's great. Definitely something we want to always screen for with mental health concerns. Cardiovascular is important here because they're reporting chest tightness. We've got random episodes of chest pain, some dizziness, which could be, concern for perfusion if they're being dizzy. Shortness of breath, heart palpitations that have been happening and stopping over a few months. Spontaneous resolution of pain. They're having some weight loss, which there's a bunch of different reasons you could have that. Thyroid issues or just depression or other mental health stuff. And then we see here they drink alcohol socially, so that's not something that's jumping out to us. The client reports having a glass of wine with the evening meal yesterday. So none of that's really jumping out for psychosocial there. And then just making sure we don't miss anything, here's the vital signs tab. So this patient right now, same time, we can see it's also still 8 a.m. here with this note. Temperature's 99, a little bit elevated, but I wouldn't say they're febrile right now. Getting close to tachycardic here. but could be due to anxiety. Respiratory status is totally fine, 18, 98 on room air. That's great. Blood pressure is great. So now we kind of have this picture in our head of how they're doing physically and mentally. Let's go over and start looking at the questions. So this is the first of 6. Which of the following findings requires immediate follow-up? And then we select all that apply. One of the nice things about this item is that it's actually a traditional item. You've seen these items before on your tests in nursing school, and as we know, the questions that are inside of a case study can be any item type. They can be some of those newer ones, which are a little intimidating, or they can just be these traditional items that you're used to seeing. So that's kind of nice here, because this is an item that we've seen this before. So let's go through one by one, and we can see here this word immediate is bolded. So we're not talking about like, hey, yeah, we want to make sure that they're going to discharge with this information. We're focusing on what's going on right now. So let's pick out those cues here and see what we find. Select all that apply. So chest tightness, absolutely. That's something we want to follow up on right now. There's some scary things that are related to chest tightness. Flat affect, that's definitely a concern for like a mood disorder, or there's some other neurological disorders that can cause that. But like, is that my primary focus? Maybe not. Heart palpitations, that's another cardiac. When we're thinking ABCs, that's way up there. Minimal eye contact, that also feels like a mental health issue that we definitely want to follow up on. But like right now, it's probably not our highest priority. Shortness of breath, absolutely. ABCs, this could be perfusion. It could be because of a respiratory issue. A lot of reasons that this can be scary. Weight loss, this has been over the first, or I think it's the last couple weeks or some extended amount of time. So this is not our primary concern right now. So go ahead and hit submit. Now, because this is a case study, in our study product, you're not going to see the answers right away, because the answers are the answers to the question and the explanation, because that would just totally give away the next question. So we're going to hold off on that and come back to it, because we definitely want to learn from what we've answered this question with here. So moving on to the next one. So item number 2 of 6, and we're looking over here. It doesn't say that there's new exhibit information, and we can see over here that it's the same 3 as before. Sometimes we'll add a new time interval here to the nurse's notes or the vital signs. They haven't done it on this situation, and if they had done it, they would have told us over here. So we don't need to look at the notes again. We can just focus here on what the item looks like. So one of the newer NGN item types, this is a multiple response matrix item. So going into this question, we know that it's multiple response. So I could go ahead and I could click every single answer, trying to get as many points as I could, but they would knock off points for the incorrect answers. So we want to focus in and make sure we're only clicking the correct answers, because they're going to subtract a point if we select the wrong ones. So looking at it, the best way to think about it really is column by column. So let's just focus. Here we're comparing hyperthyroidism, myocardial infarction, heart attack, and then panic disorder. So let's go one by one, starting with hyperthyroidism. What are the findings that would be associated with that? It says here they may support more than one disease process. So we know that diaphoresis, it doesn't just end up in one of these spots. It could be on all 3 of them. So diaphoresis, meaning sweating, definitely with hyperthyroidism, they have hot flashes, they have poor, they have more sensitivity to heat and poor ability to cope with the heat. Like if they're outside in the summer or they're just in a situation that's giving them a lot of heat, they don't cope with that very well. Trembling hands, absolutely, that's related to hyperthyroidism because of the hormone imbalances. And then also heart palpitations here absolutely is related to one of the thyroid conditions. Sometimes I feel like I get hung up on hypo versus hyperthyroidism. Hyper here meaning a lot of extra. So they have hyper extra thyroid hormone. And when you have extra, you're more stimulated and you do have heart palpitations. So we want to click that one. And I believe shortness of breath is also that one. I'm kind of, I need to think about that some more. So let's move on to the next column, myocardial infarction. Diaphoresis is absolutely one of those subtle signs that people don't always realize. A little bit of heartburn and some sweating, it feels like, it's kind of random, but maybe not a big deal. But it's actually one of those subtle signs of a heart attack. So absolutely, we want to remember that one and recognize that that's one of the appropriate things to click here with myocardial infarction. Trembling hands, it doesn't feel like particularly characteristic of MI. I'm gonna leave that one off. Heart palpitations, absolutely. This is a cardiac problem. They're gonna feel some flutters and some weird stuff going on. Shortness of breath, absolutely. There's a big issue here with perfusion. When you're having an infarct in your heart, you're not getting that oxygen where it needs to be, and so you're gonna become short of breath. And then thinking about shortness of breath here, absolutely that's related. You know, when you're having an infarct in your myocardial tissue, you're not getting perfusion to your heart's not working like it's supposed to be, the blood's not moving forward as well as it's supposed to be. And so absolutely shortness of breath is something that you could see with that, and it's definitely one you want to follow up on. All right, and then panic disorder. So this is more a mental health issue. And so the physiological stuff going on is more related to how these hormones our body is releasing, like adrenaline, how it's affecting us. So it doesn't mean that, you know, shortness of breath, I would absolutely say is related. Does that mean we're having a respiratory problem? No, but we're having a situation where our body is saying like, oh, it's time to panic, it's time to go, something needs to happen. We're short of breath because our body's getting ready to do something because we're feeling that anxiety of panic. Heart palpitations also definitely related to panic disorder. You know, with the flood of stress hormones you're having, a lot of people do report chest discomfort. So they'll have that feeling of like flip-flopping in their chest, and that, you know, we call that heart palpitations. Also diaphoresis, again, similar or related to the same thing. You're going to see some sweating. So that would be related as well. Trembling, I think that's related. I mean, you're feeling really freaked out and people get trembly when that happens. Okay, so then let me just double check what we're missing here. This one's empty. I think that's okay. And then hyperthyroidism, this one's empty. I feel like they might be short of breath, especially because we know that with temperature dysregulation, and they do have elevated temperature, shortness of breath is sometimes this thing the body does to kind of compensate for that. So kind of releasing more air, breathing faster, they may feel like short of breath. So I feel like we could click that one and see how we go. So let's go ahead and submit. And again, we won't see the explanation just yet. So we'll move on to the third question. A lot to think about with this. All right, item 3 out of 6. And we can see here that something else has popped up. And then also it tells us right here, the nurse has reviewed the information from diagnostic results and laboratory results. So we want to make sure we're checking out those tabs again. So coming over here, we've got laboratory results. And as we know, troponin is one of the hallmark labs that tells us whether or not somebody's having a heart attack. So here with troponin, it looks like they've tested 2 different types. I don't know exactly the difference, but I know that troponin is a test they do to tell me whether or not they're having an acute myocardial infarction situation. So I can see here, they do give me the reference ranges. So I know that a troponin value here of more than this is going to be concerning because the normal value is less than 0.1. So anything that's above that would be concerning. This person's value is 0.0. So the normal being less than 0.1, we're in that safe range. We've got a normal value for this troponin. And then the same here, they're at 0, the normal is less than 0.03. So I feel like we're really ruling out here heart attack is the cause of this person's symptoms. So again, we're going through the clinical judgment measurement model, we've analyzed the cues, and now we're kind of prioritizing like what is going on and what do we do here? And then we need to also make sure we look at the diagnostic results. So looking at diagnostic results here, the ECG is showing that they're in sinus tachycardia. We already knew they were in tachycardia. We looked at their vital signs and their heart rate was elevated. So, and this is not one of those findings like there's certain, you know, ST segment elevation and other arrhythmia findings that would tell the provider that there's a potential for heart attack here. And they're really the ones to look at that and make decisions most of the time. But here we know at least that this is something we already knew was going on, and it's not one of those hallmark scary arrhythmias that make us think heart attack. So we've kind of ruled out heart attack, which is great. All right, moving over to look at item 3 here. It's asking us to complete the following sentence by choosing from the list of options. So the nurse recognizes that the client is at highest risk. So again, we have that bolded word and highest telling us that this is the most one we want to focus on. It's a priority here. That doesn't mean that the other ones aren't potential answers, but we're focusing on the most important here, which makes sense because this is the prioritizing hypotheses question in our clinical judgment measurement model. So highest risk for developing blank as evidenced by blank. So here, let's look at our options and see what we can pick from. So we think they're at highest risk of heart failure, agoraphobia, or thyroid storm. Here with this patient, I think from everything we've read in their history and physical especially, I feel like we're leaning towards a mental health issue with their affects, and then they're not reporting a lot of GI distress that people can have with thyroid issues, like especially, bad hyperthyroidism. So I think we can kind of rule out the heart failure because we already know it's not cardiac. And I think we can go away from the thyroid issue right now. And I think we're going to focus on the mental health condition. So here I would say the most related mental health condition here is agoraphobia. So I think that's going to be our answer for what they're at highest risk for, because they're having those panics in situations, and it seems to be they were on a bus when it happened, so maybe it's related to being around people. So let's click that as our concern for like a complication or a future problem they may develop. And then as evidenced by blank. So let's see what our options are here. Fear of future attacks, they absolutely have that. We saw that. And then evidenced by chest pain and palpitations. Well, that's definitely related to panic attacks. But if we're trying to support our answer of agoraphobia, that may not be the best. And then here, recent weight loss and loss of appetite. So again, with this type of question, our first blank has been answered. And so the second blank is needing to support what we've answered in the first blank. So we really need to focus on this wording as evidenced by blank. So really what tells us that agoraphobia is going to be the answer? And that I feel like is fear of future attacks, because when you get around a group and you have that anxiety, I think is characteristic of agoraphobia. So I think we're going to go ahead and click fear of future attacks because it seems most related. All right, and again, we'll come back for the explanation here. So moving on, we got question number 4. So we're over halfway there, and we're moving on in the measurement model to the stage of generating solutions now. And then we have this little alert here again that says the nurse has reviewed the information from nurse's notes. So we know they've added more information. There's not a new tab here, but if we scroll down on the nurse's notes, we can see there's a new time frame. So it was 8 a.m. and now it's 9 a.m., an hour later. We're evaluating the client. They look irritable, fidgety, restless, still organized and logical thought process. Anxiety is 6 on a scale of 0 to 10. And then we're giving them a benzo to help with anxiety. So this alprazolam is one of the benzodiazepines. So that's going to help with anxiety. So we're going to go ahead and give them that medication here. And then other solutions we can provide. That's what we want to focus on with this question. What else can we do to help this client right now? So here we're going to say for each potential intervention, click the intervention as indicated or contraindicated. So this is again a matrix item, but it's a multiple choice matrix, which means that there's one answer for every row. So they are telling us, give us one answer in every single row, which helps us understand that they're not going to take away points if we click the wrong option, because they're telling us you need to put an answer at every row. So this is one of those where they give you points for every right answer, but they don't take away points because they've already said, we want 5 answers. So give us 5 answers, please. So just kind of think about that as we go through here. So one potential intervention is encouraging the use of positive self-talk. I think that's appropriate. This person, again, if they're having some mental health issues, could benefit from that. I think a lot of people can benefit from that. So I would say that that's indicated. So we would click this column. And I think it's helpful to kind of treat each row as a separate question here. So then we're going to go on to the next one. And it says, ask the client about any recent life stressors. So is it good to bring it up right now? Is it therapeutic to talk about that? I think generally when we read about therapeutic communication, we want to help the client open up about this kind of thing. So I think it's probably indicated. We'll click that. Assist the client to recognize physical symptoms of anxiety. This is absolutely helpful because here we've given a benzodiazepine. If they walk away with a prescription for that medication, they're going to need to know when to take it. So having them understand, like, what is it that's like a precursor, a sign that this may be coming, a panic attack, can we recognize those signs? So this is a really important, I think, a great nursing driven intervention here is we want to make sure they can understand when if this happens again. Encouraging the client to spend some time alone when feeling anxious. Oof, that one's tricky. Should they be alone when they're anxious? If we're considering agoraphobia, that one's kind of difficult. I don't think we want to do that. I think we want to encourage support systems is what we usually read about in our nursing textbooks. But then again, if they're going to be agoraphobic, I'm not sure about that one. I think being alone can be relaxed. Let's click indicated. Not sure. And then reinforcing abdominal breathing exercises to use for anxiety. That's very much something that's appropriate for most people. So this is a great situation to use that intervention, which I think is why it's an important option here, because this is something they can do when they're feeling that panic coming on and the medication maybe isn't available or they haven't taken it. And this is something they could sit down and do. And if we teach them this, then it can help them in the future. So I would say that's absolutely something we want to do. So we answered all 5 rows. Perfect. Move on to the next one. All right, item number 5 of 6, we're getting close. It says the nurse reviews information from nurse's notes and vital signs. So we know we've got some more information to look at. Let's scroll down further on the nurse's notes. It says here, a couple hours later, the client rates anxiety as 2 on a scale of 0 to 10. That's great. So we've come down from a 6 to a 2, and they want to go home. They're ready to go home. The client is referred to an outpatient mental health clinic for follow-up. That's perfect, because it is the nurse's job absolutely to make sure that we're not just, hey, here's a Band-Aid, now you can go home. We want to make sure that this chronic condition is going to be carried through with further treatment. So we want to make sure, hey, do you have the phone number for the clinic you need to go with? Do you have an appointment set up yet? This is something, when you're discharging a patient, this is the nurse's job. You need to make sure that this is happening. So here we say the client is referred to the clinic. Perfect. We can check that box. And then our other new information that we got here was under the vital signs. So we can compare the 8 a.m. vitals to the 11 a.m. vitals and see that with the anxiety going down, things have really normalized here. The respirations have gone down. They're still satting really well. Everything else is getting much more normalized, which is great, which is another good indication that they are getting close to ready to discharge. All right, so looking at the item here, we're saying the nurse is reinforcing teaching about newly prescribed medications. So we've got alprazolam, which is again that benzodiazepine, which helps acutely with anxiety. So you take that when you're really feeling the symptoms. And then sertraline, which is going to be a long-term medication that you take scheduled at the closest time possible every day to reach a steady state of that medication in your bloodstream. It's an SSRI. So it's an antidepressant. It's going to help with depression, anxiety. So we've got 2 new medications. They're similar in the category of treating mental health, similar in that way, but they're taken very differently. So we need to say here, which of the following statements by the nurse are appropriate to include in the teaching? So what do we say to our patient here to make sure they understand? Select all that apply. Again, this is one of the older item types, so that's helpful because it's not one of the newer, more intimidating ones. For option 1 here, it's saying avoid driving after taking alprazolam. That's a great thing to teach about. It is definitely a nursing intervention because it's very safety focused. If you take a benzodiazepine and then get behind the wheel, there's this risk of that sedative side effect causing an accident. They usually talk on the prescription bottle as well. They say, don't drive or operate heavy machinery when you're taking this medication because it's dangerous. So this is something we want to drill in and make sure they understand that if you take this medication for your anxiety, it could make you sleepy. And then it could be dangerous to drive a car. So we're going to click that one. And then contact your healthcare provider immediately if you experience suicidal thoughts. This is very important. As we all know, when you first start taking an antidepressant, you can quickly get to this period of kind of euphoric, you're feeling more energy, you're feeling better, which is great. But if you're still kind of depressed, this can lead you to have more energy to act on a potentially suicidal action. So here, and this is particularly relevant in the younger group of people, that's when they see it more. So this patient's 21. So this is something we absolutely want to make sure gets across, is that you're taking a new SSRI. There's this potential for this, very devastating complication here. So we want to drive home that, hey, if you're starting to have those suicidal thoughts which happens kind of in that initiation period of taking the medication, contact your healthcare provider, because that's not normal. It's not a long-term side effect of the medication. So they really need to know that right now to look out for that. So we definitely want to cover that with this patient. Do not abruptly stop taking alprazolam because you may experience withdrawal. That one is true. That one I'm less confident on. Let's click it. Limit alcoholic beverages to no more than 1 drink a day while taking alprazolam. That one's a little tricky because I think they're not supposed to drink at all when they take alprazolam. But limiting is good if it's a concern, because both alcohol and this benzodiazepine are going to be sedating, which is why we're concerned about it. I'm not going to click it because I'm wondering if they shouldn't have any. So instead of 1, it should be none. So I'll leave that one off for now, but I'm kind of hung up on it. We'll see. And then option number 5, take sertraline at the onset of a panic attack. That's wrong. We know that SSRIs, like I said, they need to be taken at the same time every single day because they help prevent. So taking this, you may be taking too much of it, which can cause complications if you're taking it right at the onset of a panic attack. So that's incorrect teaching for this. So we're definitely going to leave that one off because I feel pretty confident that's wrong. So looking back, we've got 3 selected. This is a multiple response. It doesn't tell us how many to click, which means that if we get an option wrong, they're going to count off a point. So I really want to be careful here. Limit alcoholic beverages. Since I'm on the fence, I'm not going to click it because I don't want to lose a point. All right, submit. All right, moving on to the last question here in our case study. It doesn't say we've gotten any new information. I don't see any new tabs over there. So I think we're looking at a future time interval. So the client returns to the mental health clinic for a 1-month follow-up visit, which is great because I love it when we can also see, like, what is this looking like long-term? Which client statement would indicate that the client requires additional therapy to cope with panic disorder? So this is a single best question, so there's only one right answer, which is really helpful. Let's read here. I realize that my panic attacks are under control. I'll eventually need to be tapered off. I purchased a watch that alerts me when my heart or respiratory rate increases so I can begin breathing exercises. That sounds like good. I'd say they don't need additional therapy if they're doing this. That sounds like something they should be doing. Probably helpful. My support group has been helping to identify when my thoughts are not realistic so I can talk myself out of feeling the panic. That's really helpful. I mean, having someone else help you realize when you're spiraling is great. So I don't think that needs additional therapy. I think that's great. I think maybe they're doing well. Taking the bus has been a trigger for me, so my boss is letting me work from home. While that may not be their ideal, we don't want them to necessarily have to sequester themselves at home because of their medical condition. So that may mean that there's opportunity for them to progress more. I mean, it's great that their boss is being flexible, but is that what they want long term? Taking the bus. This is kind of one to mull over a little bit. Trigger for me. Yeah, they're having to request accommodations from their job because their mental health condition is holding them back. So I would say that this is something that maybe they could progress with. So I think that's the right answer. We'll go with that. So we'll submit, and then we can finally see the explanations, which is great. Let's go ahead and move backwards though, because this is item 6 of 6, and we want to see all the explanations. For UWorld, we have them, of course, for every single question. So we can go back a little bit and see, here's the explanation for this. So we'll talk through why every single option's right and wrong. We got scored 3 out of 3. That's great because this is one of those where we could have gotten points knocked off and we didn't, which is awesome. If you want to know more, you can click this little thing, scoring rule. There's a little infographic about how that works. We did great for this one. For our multiple response matrix, I think we got them all right. And this is another one where you could have gotten points knocked off. So there's that same scoring rule information there. And it tells us 11 out of 11, we got the max points, which is great. Item number 3, again, both right. This is a 0-1, which means that because they told us we had to have 2 responses, they weren't going to take away points, but we got both points, which is great. Another matrix. Okay, this one I think we hovered over for a bit. It is, let's see. So this was wrong. So the correct answer was contraindicated. Okay, so they're not supposed to be alone when they're feeling anxious. They're supposed to reach out for a support system. So, but they told us we had to have one answer for every row. So they're not going to take away points, which means that we got 4 out of 5. So 1, 2, 3, 4, and they didn't subtract a point even though we got that one wrong. So 4 out of 5, that's great. And then number 5 here, another SATA, we got 3 out of 3, which is great. So overall, we did pretty good for this case study. And then when you are studying and taking your time, obviously we want to highly encourage you to go through and read. Even if you got the answer right, why? Like understanding the why behind the correct and the incorrect options is really that learning opportunity here. So as you work through these, I would definitely encourage you to start again from item number 1 and read your explanations, because that's where the learning is really gonna be reinforced. And that's it for this case study. Whether you're taking the current Nclex or the next.
Okay, any questions so far? Anyone still there?
Yeah, I'm still
No.
here.
Right, any questions so far? So I'm just going to show you a lesson plan and one of the questionnaires that you will get, right? So let me see. Just pull up one from that I did yesterday. Sorry, this is the video. I don't want to show you the video. I want to show you the lesson, right? Lesson 13. Okay, so this is what your lessons is going to look like. You have your content. And then we start off. We usually use cheat sheets as well as a lot of videos. So there are videos for simple listening that are available on YouTube so that you can look at it on your own time. And as well, I will find other videos that can easily explain something to you for those who are visual learners, all right? So all these are cheat sheets. We were looking at the developmental milestone of children here, right?
We was just seeing like the logo of the business, and I seen like, are you showing the chips by chance?
Oh, yeah, I am. Let me just see. It's
And I've
not
seen
showing.
it, yeah. And
Okay, sorry, Zoom
that's okay.
decide not to share with you all. Hold on, let me pull it up. Share. Okay, so we'll go back at the top. You seeing it now? You seeing the screen with the lesson 13, pediatric milestones?
Yes, we are. No.
Right. So this is what your lesson plan would look like, the contents of all the things that we will cover on that day, what is included in this PDF. All right, I usually use a lot of videos, as I said, whether from Simple Nursing or from other sources, and these are your cheat sheets. So these are the things you see, anything that is written in black and highlighted in yellow throughout is Nclex tips. These are what you need to focus on, all right? This is what Nclex is looking for. So these are your cheat sheets. I just want to go down to the end of it where we have questions. Right, so we do the different types of scales and stuff for crying here. The notes on the scales are there for you to learn and to get visual representation of it so you know exactly what we're talking about. So this is some questions. During the class, we will do some questions, right? So this particular question was from Ewell. You get them from Ewell and Saunders during the class. The ones that are in the Google Doc, some of them are Ewell and some of them are simpleness, and I'll show you them just now. All right, so these are all the childhood genetic diseases that we covered here. And then we have the congenital heart defects. All right, and then the systemic inflammatory diseases, which would be rheumatic and Kawasaki disease. So this is basically it. Sometimes you will get the questions in between, and sometimes you will get it at the end of the class. I don't know just now. So the questions we would discuss it in class, we would look at the keywords. Why is this not loading? Right, sorry. Right? So we will look at it. So they would say, for instance, what socioeconomic indicators would identify as risk factors for a 2-month-old infant who develops failure to thrive, right? So the diagnosis here is failure to thrive. They're looking at socioeconomic indicators. And the age of the child is 2 months old. So in this case, it would be select all that apply. This is your basic select all that apply. So this answer would be where the mother is unemployed or has cognitive disabilities or socially and emotionally isolated, right? So 2, 3, and 4 would be the answer. And then you have the rationale for it. I will go on to get a Google Doc for you. So this is your questions and your answers, right? When you get these questionnaires sent to you, it will be sent in a link on the WhatsApp chat. You're going to enter your email address here. Okay, you always have to enter your email address in front at the top, and then on the very last page, when they ask for your code, you're going to enter your email address again. It's going to give you your score, and it's going to give you your rationals as well and tell you which one you got wrong. So these are the questions, and you get the answer key, right? So in this particular one, we go to a Google Doc that has the answers, but usually just like how they gave you the rationals in the video that you just looked at, it's the same thing. It will give you the rationale. So you have your questions here. It gives you the right answer. Okay? And let me just find another one and show you how it is broken down. Forms just now. Go to pharmacology. So again, you enter your email, and I just want to bring it up to show you. So your answer key, it has the answer, and it gives you your rationale. Okay? So physical therapist is the person the client with Parkinson's disease, right? Which member of the interdisciplinary team within this consult to address the client's impaired mobility is a physical therapist. So that's number 2. Answer number 2, then this often consults with the members of the interdisciplinary team. And then they give you the rationale here as well. Parkinson is a slowly progressing neurological movement disorder that leads to disability. So they would say, again, the speech therapist would not be the one, and why the speech therapist is not, right? The physical therapist, you get why it is and why the other persons are incorrect. So it's a learning process as well when you do the questions. What I wanted you to see too is, so this is just pharmacology. I want to show you the breakdown in the different questions. Sorry. Okay, so for instance, endocrine system. Oh, this is pharma. Why am I only pulling up pharmacology questions? Endocrine. Right, so your questions now are divided up into sections. So this first section is physiological adaptation. So they would talk about following the thyroidectomy. The patient appears anxious and has tingling in the mouth. So more or less your med-surg questions, right? Let's scroll down. My computer is probably more tired than I am today. He's not cooperating. Let me see if I can get it to load better. Close off some of these tabs. Right, it's still loading. Just give it a couple of minutes. Oh, seconds, sorry. Okay, so there it is. Right, so you had physiological adaptation, which we had approximately, well, let's keep scrolling. So that was a big section that had 30 questions. We have 106 questions. You would always see how many questions in a bracket at the top here, right? So 106 questions. You had 30 in physiological adaptation. Then we had basic care and comfort. You see, we had 9 questions in basic care and comfort. That's section 2. Section 3, we had health promotion and maintenance, 9 questions. So you see how it is divided up in the various areas where nursing council Nclex is concerned. Then we have management of care. So you look at which area you are weak in and you need to revise in, right? So don't just do the questions and don't analyze the questions. First of all, which area you're weak in, and then go in question by question and see why your choice of answer was the wrong or right answer. Look for your keywords. So this area is pharmacology and parenteral therapies, dealing with the drugs that we used, right? And how we're going to give IV treatment. This is reduction for risk potential. And then the final section would be safety and infection and control. Where did that go? Right, safety and infection control. So you have all the various areas that Nclex is going to be testing you. So you see which area that you are deficient in and you need to spend more time on. Okay? And that's it in a nutshell.
Okay. Very informative.
Okay. It dispels some of the fears and anxiety about Nclex.
Huh?
It dispels some of the fears and anxiety about Nclex.
Yeah, it did. It did.
All right.
But being a repeat test taker, right?
Mhm.
I mean, I've seen a lot of things that I would have not have known going into the exam before.
Right.
So I guess that would have made me not pass the exam at that point in time, right? So I
Mhm.
think going forward, you are utilizing all the strategies that you would have now would basically
Mhm.
enhance me more and give me the tools that I would need now to be successful, more or less.
Yes, it will. We prepping you in every which way.